Infections acquired during healthcare delivery are a major problem for global health, causing harm to patients and putting the very notion of safe, trusted health systems at risk for all countries. 1 in 10 patients get an infection while receiving care. Infections cause up to 2/3 of deaths among hospital-born babies.
These are just a few shocking problems we are facing in our world. But healthcare-associated infections are avoidable, and to prevent these infections, including those antibiotic-resistant, is a key priority for WHO. This is why WHO has engaged experts and colleagues with field experience to resolve this problem. Also based on scientific evidence, we all together identified the core components that make IPC programs successful to prevent harm.
The new core components are absolutely essential for us to have for low resource settings, because WHO documents carry a lot of clout with the ministries of health. It can prove to be cost effective, but most importantly, the IPC focal people working in healthcare facilities find it a great support, and it gives them the clout to do their job properly.
So infection control is really critical to the control of antibiotic resistance. You know, if you think about the spread of antibiotic resistance, it's just like a bushfire. And of course, yes, we need new fire trucks and new helicopters, that is new antibiotics, but they're 5 or 10 years away. And in the meantime, we need a fire break, and that fire break is good infection control. And so this is why the core components are so critical. Whether you're a wealthy country or a poor country, all countries need a national policy on infection control, and the core components are exactly what we need to direct that effort.
WHO recommendations identify 8 core components that make infection prevention and control effective and aim to support countries and health facilities to prevent healthcare-associated infections and antimicrobial resistance. The first component is about having an infection prevention and control program supported by a dedicated budget and trained staff.
Infection prevention control programs are essential in healthcare facility level because healthcare-associated infections lead to high cost and high mortality.
In order to ensure establishment of strong infection control programs, we need to make sure there is political commitment at the highest level, starting with resolution at the World Health Assembly, and then moving on to establishment of regional programs.
The second component is to have and implement guidelines on infection prevention and control standards and operating procedures.
For us, guidelines provide a standard that we can follow, we can all agree on. So now we have, like for example in Chile, the healthcare providers, the directors of the hospitals or the infection control programs use the guidelines in order to allocate resources or organize healthcare in order to make it safer for patients.
The third component is education and practical training based on infection prevention and control principles and best practices for healthcare workers, managers, and other professionals.
Education and training can change practice if we do 4 things. Number 1, if we contextualize within their experiences. 2, make it very practical. 3, have champions to drive the process. And 4, get the administrators involved by having a proper advocacy plan.
The fourth component is healthcare-associated infection surveillance and timely feedback of results, both at the national and facility level, to detect the problem and guide interventions.
So when hospitals do surveillance, they usually measure the burden of infections and describe the pathogens causing infections and their resistance pattern. Good quality surveillance data contributes to tailored prevention activities to reduce the burden of infections and resistance of organisms.
The fifth component is the use of multimodal strategies to implement recommendations to improve practices at the point of care.
These guidelines reinforce the value of multimodal strategies for decision makers, for leaders, for implementers. And what this means is making sure the right resources are in place, the infrastructure to support improvement. It means using the most effective methods of training and education. It means checking that the right thing is happening at the right time, monitoring and evaluation and feedback. It means communicating and advocating and campaigning for infection prevention, and all of this taking place within a culture that supports improvement in infection prevention and control. All countries and all health facilities can benefit using a multimodal approach to protect people.
The sixth component is regular monitoring of healthcare practices according to standards and guidelines, followed by timely feedback of the results, both at the national and facility level.
I think monitoring in the field of infection control is a very important issue And for instance, I would like to give you an example from my own country. We have established hand hygiene consumption as an indicator for good hand hygiene. And meanwhile, more than 1,000 hospitals in our country are using this indicator, and we were able to achieve a lot of increase in this field.
The seventh component is to make sure that bed occupancy does not exceed the standard capacity of the facility and that staffing levels are adequate according to patient workload.
Level of staff and bed occupancy. We have three major challenges to overcome. First is the lack of human resources on IPC. The second is the lack of the involvement of administration. And third, we have a lack of involvement of patients and families. So we have to address all these challenges if we want to overcome this problem.
Establishing a team at the national level provides guidance and leadership that could accelerate the momentum that is needed to ensure that IPC is implemented throughout the country.
The eighth component is to ensure that patient care activities are undertaken in a clean, hygienic environment with adequate infrastructures and equipment, in particular for hand hygiene.
Water and sanitation are absolutely fundamental to preventing infections. I think this is overlooked. We know it's overlooked. We did a global report where we understand that 40% of hospitals are without, a source of water, and that's unacceptable. We walk into these health facilities and we see unhygienic conditions, and we know diseases are going to be spread. So this is something that is absolutely wonderful that it's been included in these guidelines as a prerequisite.
The last public health emergencies of international concern that was declared by the WHO showed that how important is to have infection prevention and control in place for member states to fight epidemics and fight emergencies. If we are better prepared, if we have infection prevention control structure in place, we have a better chance to fight these emergencies.
One of the great lessons learned from outbreaks like Ebola and MERS and SARS is the importance of strong infection prevention and control from a global health perspective to prevent the next epidemic.
Effective infection prevention and control can lead to more than 30% reduction of healthcare-associated infections. However, implementing the recommended core components isn't always easy and takes time and commitment. But there are great examples around the world that this is possible, even with limited resources. Countries and healthcare facilities engaging to do this will reduce infections and antimicrobial resistance and will save money. Most importantly, this will make patients safer and save lives. Thank you for committing to infection prevention and control.
Infection control is an ongoing process that promotes effective methods of prevention and control of infection. Its mission to protect patients and visitors from acquiring infections while visiting our clinic and minimize healthcare worker exposure while providing patient care. An individual's risk for infection depends upon how they were exposed, the strength of the infectious agent, the type and amount of infectious agent to which they were exposed, and that person's susceptibility to infection. At United Family Medicine, employees in certain job categories may come into contact with blood or other potentially infectious material and are considered at risk. They include nursing, dental, laboratory, X-ray, and front desk. Advocates should be asked to contact patients who present a risk by phone, but those who also serve as interpreters are included here, along with providers whose services we contact from ELINA. OSHA's blood-borne pathogen standard recognizes that blood and body fluids contaminated with blood present risk for exposure to HIV, hepatitis B, and hepatitis C. But blood is not the only consideration. Other potentially infectious materials present risk for acquiring these infections. They include semen and vaginal secretions, amniotic fluid, fluids that provide cushion, support, and decrease friction from surrounding organs, unfixed human tissue and organs, including non-intact skin, and culture media, cells, or any body tissue known to contain either HIV or hepatitis B. While saliva is typically not included, it is considered a risk for exposure both in dentistry and in instances where there has been mouth trauma. OSHA instituted a set of required workplace practices, universal precautions to reduce exposure to these blood-borne pathogens. But OSHA's scope was limited. By considering only exposure to HIV and hepatitis B and C, a host of other pathogens encountered in our workplace went unaddressed. Standard precautions incorporates universal precautions and includes additional measures to prevent transmission from other sources. They include hand hygiene, safe injection practices, safe handling and decontamination of medical equipment and environmental surfaces, respiratory hygiene and cough etiquette, and use of personal protective equipment. Standard precautions are the minimum level of infection control precautions to be used for all patients and when handling potentially infectious materials at United Family Medicine. Hand hygiene is the single most important practice to reduce transmission of infection. Whether using alcohol-based hand rub or soap and water, proper hand hygiene covers all surfaces of the hands and fingers up onto the wrists. Alcohol-based hand rub is generally preferred to soap and water. To use alcohol-based hand rub effectively, apply a sufficient quantity to cover all surfaces when hands are rubbed together, so it takes 20 to 30 seconds to completely dry. Occasional soap and water wash should be used to remove emollient buildup. Under certain circumstances, soap and water is preferred. Soap and water should always be used when hands are visibly soiled. And because C. difficile forms alcohol-resistant spores, soap and water is also preferred when infectious diarrhea is present. Pathogens prevalent in the community at any given time may also call more appropriately for soap and water wash. United Family Medicine will monitor emerging disease information from the Minnesota Department of Health and CDC to keep you informed. For soap and water hand hygiene, wet hands with warm rather than hot water to prevent skin irritation. Add soap and rub together vigorously for no less than 15 seconds. Rinse thoroughly with fingers pointing down and dry with a disposable towel. Use the towel to turn off the faucet. Total duration from wetting hands through drying should take 40 to 60 seconds. Hand hygiene should be performed prior to and following any direct patient contact. Whenever hands become visibly soiled or contaminated, this includes coming into contact with blood or other potentially infectious agents, non-intact skin or mucous membranes, or contaminated equipment. Whenever gloves are removed, and when moving from one body site to another, gloves should be removed, hand hygiene performed, and new gloves applied. When entering a designated clean work area, this includes prior to preparing medications or procedure trays and prior to handling invasive devices. When entering or leaving the clinical work area, This includes arrival in the morning and prior to leaving for the day, and should always follow bathroom or lunch breaks. And prior to and after personal contact, including touching eyes, nose or mucous membranes, or when handling personal care items. Gloves should be worn when exposure to blood, body fluids, or other potentially hazardous material is anticipated. When there is direct contact with patient's eyes, nose, mouth, or other mucous membranes or non-intact skin, when invasive procedures are being performed or a body cavity is explored either manually or with an instrument, and gloves are a requirement at United Family Medicine when giving injections. Gloves are considered single-use and to be discarded into appropriate waste containers when removed. They should be changed when the integrity of glove material is compromised and are to be worn whenever caregivers have cuts on their hands or other breaks in the skin. They are to be removed from the wrist in a peeling fashion that turns them inside out to contain contaminated materials within. Personal protective equipment includes gowns, worn to prevent contamination of skin or clothing when a known or suspected infectious agent may be transmitted via direct contact, splash or spray, or exposure to airborne substances. Gown front and sleeves are considered contaminated. They should be removed in a peeling fashion, starting at the neck and shoulders, turning them inside out to contain contamination. During removal, contact should only be made with inner surfaces. Personal protective equipment includes masks. These are worn when a known or suspected infectious agent may be transmitted via exposure to respiratory secretions and when there's potential for splash or spray. They should also be worn when caregivers have a respiratory illness. Type of mask worn is based on exposure risk. For illnesses spread by droplet, standard surgical masks should be worn within 3 feet of patients when caregiver immunity has not been established. Small particulate N95 respirator masks are worn when pathogens may aerosolize into airborne particles small enough to be carried on air currents and capable of penetrating surgical masks. N95 masks are required for all cases of active or suspect tuberculosis. Latent cases are not infectious. N95 masks should also be worn for protection when measles and varicella is suspect and caregiver immunity has not been established. N95s may also be considered when there's potential for aerosolization of pathogens during certain procedures that create heavy splash or spray. Respirator masks are not one-size-fits-all. They require customized fit and seal checking for leaks with each use. Fit testing and training is offered twice yearly. It's a good idea to keep a mask in your work area. Backup stock is kept in the cupboards across the hall from advocate offices. All staff members are expected to participate in fit testing when provided and compensated if they attend in their time off. Staff members who've attended sessions but cannot be properly fit should exclude themselves from care of patients with airborne illness. Masks should be removed and replaced when visibly soiled or wet. The face piece should always be considered contaminated, and removal accomplished from ties or elastic furthest from it. Personal protective equipment includes protective eyewear. This is worn anytime there is potential for splash or spray of infectious material. United Family Medicine provides masks with attached eye shields, goggles, and face shields. The front of used eyewear, like masks, is considered contaminated. These also should be removed from the back. Reusable goggles should be decontaminated prior to reuse. In the event eyes are inadvertently contaminated, they should be flushed liberally with water. Eye wash stations are located in the lab, Yellow Team Soil Utility Room, and in dentistry. Additional PPE is available on each team and includes head and shoe coverings. Guidance documents in place include strategies to prevent exposure. These include placing scheduling comments to alert staff of potential disease conditions, asking patients to mask on arrival, priority rooming, appropriate use of personal protective equipment, and good environmental cleaning practices which help to protect everyone. Recognizing risk and acting appropriately to prevent exposure is the basis for transmission-based precautions. It is a thoughtful process, and while guidance can be provided and policies written for infection control to be truly effective, communication is key. Scheduling notes, signs, and simple sharing of information between departments and individuals helps to prevent the spread of disease. Sharps include any item that can puncture, cut, or otherwise break the skin. Examples are needles, scalpels, lancets, and dental scalers and picks. Glassware and hard plastics that have broken, exposing sharp edges, are also considered sharps. Sharps are never reused, bent, recapped, or in any way manipulated by hand. Where present, sharp safety devices are to be engaged immediately following use. Two-handed needle recapping is expressly prohibited. Replacing needle caps may only be performed using a one-handed scoop. Sharps are to be discarded at their point of care in biohazard-labeled puncture and leak-proof containers that are stored in an upright position. Never reach into sharps containers and seal and discard them once they've reached fill lines. Avoid hand placement directly in the path of a needle when giving injections, and be sure to ask for help when needed to restrain children. Hands should never be used to handle broken glassware or hard plastics, even when wearing gloves. Pickups should be used, or borrow a broom and dustpan from the lab. And please let us know what you know. Provide suggestions to your manager or safety officer if you become aware of safer sharps options. Biological waste is regulated by federal, state, and local law. We have already discussed proper disposal of sharps. Regulated waste also includes liquid or semi-liquid blood or body fluids, and waste that may release contaminated material when handled. This includes saturated articles that may release material if compressed, and those caked with dried material that may flake when handled. It also includes live or attenuated human vaccines. Infectious cultures and equipment used to manipulate those cultures are also included. Biohazard labeling is required on all biological waste meeting criteria. When leakage can't be contained by primary containers, including red bags, it should go into secondary containers. These should be leak-proof, able to hold all contents, and be securely closed for transport, and display the biohazard symbol. Contact surfaces should always be disinfected between patient visits. Friction to physically remove visible soil or organic matter removes large numbers of microorganisms and should always precede disinfection. Protective underpads may be used to minimize gross contamination. But cleaning patient equipment isn't the only consideration. Also important is regular and routine cleaning and disinfection of environmental surfaces. Countertops, keyboards, and other horizontal surfaces should also be wiped down regularly. This includes those at front desk workstations. Spill kits are available in the team soil utility rooms, at reception desks, and in the lab. They contain instructions for biologic cleanup, personal protective equipment, absorbent and disinfecting agents, and biohazard bags. They should be restocked immediately following use. Only nursing, lab, and dental staff are permitted to clean biologic spills. Report bedbug sightings to your supervisor immediately. Fumigation is only ordered when bedbugs have been observed. Glove and collect a specimen if possible. This should be placed in a tightly sealed formalin jar and left in the affected room for the exterminator's inspection. Turn off exam room lights and seal lower door edges with table paper. Sign the room "Do Not Enter" with the date and time. Lobby videos may be reviewed to see if furniture was occupied. This should be placed in the room for fumigation also. Lobby chairs are heavy. Be sure to glove and ask for help with these. Doors should remain closed and articles left within following fumigation based on the exterminator's instructions. Viruses causing hepatitis B and C and HIV gain entry from contaminated Sharps injury, contact with mucous membranes, or through breaks in non-intact skin. Hepatitis B and C viruses target cells of the liver. Acute phase symptoms may include fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, clay-colored stools, joint pain, or jaundice. Both hepatitis B and C may occur without symptoms, and while either disease may clear entirely, both have the potential to cause chronic infection capable of ongoing transmission to others. Chronic carriers are more likely to develop chronic liver disease, liver failure, or liver cancer. Hepatitis B and C may survive on contact surfaces for 7 and 4 days, respectively. Hepatitis B vaccine is provided at no cost to United Family Medicine employees. It is safe, effective, and can prevent infection even when given after exposure. There is currently no vaccine for hepatitis C, but combination antivirals have been effective in eliminating the virus or decreasing viral load. The human immunodeficiency virus attaches to and destroys a type of white blood cell, the CD4 T cell. As these are destroyed, certain infections and some cancers that would not affect healthy individuals emerge, a condition known as AIDS or acquired immune deficiency syndrome. Symptoms may include dry cough, severe unexplained fatigue, rapid weight loss, recurrent fever or night sweats, and swollen lymph glands. There is no cure for HIV, but antiretroviral drugs can decrease viral load to preserve immune function. Risk from any significant injury varies based on multiple factors. Overall risks are presented here from a single needle stick injury from an infected source. No risk is considered acceptable under OSHA's bloodborne pathogen standard. Even brief or seemingly inconsequential risk can result in disease transmission. While the vast majority do not, it is essential that you act. It's very important to excuse yourself and ask the patient to wait. In our experience, it can be difficult to get patients back for necessary blood work once they've left. Inform your manager immediately. They will engage the patient to have labs drawn. Act immediately also to cleanse the exposed area. For skin exposure, wash with soap and water a minimum 40 to 60 seconds. For eye or mucous membrane exposure, flush liberally with water and saline. As soon as you've cleansed the site, obtain a United Family Medicine Blood and Body Fluid Exposure Red folder. These can be found in all nursing team stations, the lab, and dentistry. Protocols included in the folder outline responsibilities for employees, managers, and the lab. Complete the employee report included in the folder. Answers from the report will determine whether yours was a significant injury and steps that must be taken. Call Employee Occupational Health Service at 651-241-5693. Be prepared to answer questions from your report. Employee Health will conduct a confidential medical evaluation. If the injury occurs after hours, follow instructions included in the red folder. This may include evaluation in the emergency department at United Hospital. Evaluation and treatment is confidential and available at no cost. Aseptic technique is followed when preparing and administering all medications and for sterile procedures. Procedures should be performed and potentially infectious materials handled so splash, spray, and spattering is minimized. Shoes covering the entire foot are required in areas where invasive procedures are performed, blood and body fluids are processed, or hazardous materials are used. Mouth pipetting or suctioning of any material, including blood, is strictly prohibited. Manufacturers of multi-dose vials are only required to demonstrate sterility for 28 days after first access. For this reason, vials should be dated with first use and discarded after 28 days. Vaccines are the exception to this rule. Multi-dose vaccine vials should not be discarded and may be used until labeled expiration dates. Any vial marked single use should be discarded after first use. Soiled linens are collected in appropriately labeled containers, taking care not to overfill. Laundry should be handled to prevent exposure and contamination of personal clothing and personal protective equipment worn when appropriate. United Family Medicine maintains a supply of disposable scrubs should your personal clothing become contaminated. These are located in the provider coat room. Food and drink may not be stored in or on cabinets, countertops, bench tops, shelves, refrigerators, or freezers in laboratory or clinical areas. Eating, drinking, applying cosmetics or lip balm, and handling contact lenses in patient care areas or where patient supplies are stored places both patients and staff at risk, so is also not allowed. And smoking is not allowed in any area of the building. We work best when we work together and value your input to identify disease transmission hazards and share ideas for safer work practices to prevent infection. Please share your thoughts with your supervisor or safety officer. You may also use safety hazard concern forms found in the employee break room and place these in the suggestion box for consideration. We appreciate all your efforts to protect our patients, our staff, and the greater community.
Infection prevention in a healthcare environment is critical. Healthcare-associated infections, or HAIs, affect one patient in every 20 admissions, kill 100,000 individuals a year, and cost $45 billion. One simple way to prevent the spread of organisms is to identify and control reservoirs. Staff and visitors should be healthy and not enter a patient's room if ill. Items brought into the room should be safe. Food and water should not be tainted. Equipment must be clean or sterile, and the environment should be sanitized on a regular basis. Controlling the mode of transmission is a little more complex, but with education and adherence to good practices, staff and visitors alike can help thwart the dissemination of pathogens. The CDC, NIOSH, the National Institute for Occupational Safety and Health, OSHA, and the Joint Commission are the main agencies overseeing the methods of infection control to protect patients, their visitors, and staff.
Educational video for healthcare workers on occupational health and infection control measures. Learning objectives. Review the occupational health and infection control principles. Identify the appropriate personal protective equipment to use based on the clinical assessment. Review how to put on and take off personal protective equipment safely. Recognize measures to prevent needle stick injuries. Video content. Hierarchy of control. Standard precautions. Use of personal protective equipment. Hand hygiene. Prevention of needle stick injuries. To protect workers against health hazards, we must apply the hierarchy of control. Based on this principle, first control at the source, control along the path, and only finally, control at the person. Control at the person is the focus of this module, and specifically, the correct use of personal protective equipment, PPE, including gloves, goggles, gowns, masks, surgical, or N95. Healthcare workers need to assess the risk of exposure based on the interventions performed, the patient, the type of working environment, and conditions. All those factors play an important role to determine the risk of exposure and the appropriate measures of prevention. Standard precautions include a series of measures to prevent direct contact with body fluids, blood, secretions, excretions, and minimize the spread of infection associated with healthcare. Healthcare workers need to apply standard precautions whenever providing care, despite the patient's diagnosis. Apply enough soap to cover all hand surfaces. Wet hands with water. Rub hands palm to palm. Right palm over left dorsum, with interlaced fingers and vice versa. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left palm clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands with water. Dry hands thoroughly with a single-use towel. Apply palmful of product in cupped hand, covering all surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb cupped in right palm and vice versa. Rotational rubbing backwards and forwards. Points to remember when performing hand hygiene. When hands are visibly dirty or contaminated with proteinaceous material, they should be washed with soap and water. If hands are not visibly soiled or contaminated, an alcohol-based hand product for routine decontamination of hands should be used. Ensure hands are dry before starting any activity. Personal protective equipment. Contact precautions. Gown, gloves. Some common respiratory pathogens, e.g. methicillin-resistant Staphylococcus, influenza, can be spread through the contamination of a patient's hands, the hands of a healthcare worker, or an environmental surface. Contact precautions should be applied whenever providing care to a patient suspected or known to have organisms spread by this route.
Miss Johnson, that's really the weekend. Yes, I heard. What's wrong with her? She has fever. I stayed home and rested all weekend because I know we have a tough week this week. I just need some time. Just itch the most. Just the hands and the back of the neck. Okay, can I have a look at it? Sure, you want to turn on the side? Just turn down a little bit. Let me see what part of your hands. Just right here. Okay. It looks much better than it was yesterday. Right? So don't fall asleep until she comes back. All right. Take care. Bye. Bye-bye. Thank you.
Use clean, unsterilized gloves and a disposable or reusable gown whenever you have direct contact with the patient. Remove safely the gloves and gown immediately following any contact with the patient. Perform hand hygiene immediately after removing any item of PPE. Dedicate specific equipment for use with a single patient and always clean and disinfect shared equipment between patient uses. Avoid touching your face, eyes, or mouth with either gloved or ungloved hands, as they may be contaminated. Place patients in a single occupancy room whenever possible, or alternatively with other patients with the same diagnosis. Droplet and contact precautions. Gown, gloves, medical mask, or surgical mask. Droplet and contact precautions. Diseases which are spread via droplets can be transmitted by an infected person when talking, coughing, or sneezing. For example, adenovirus human influenza. Typically, droplets travel only a short distance through the air, but have the potential to land in the eyes, mouth, or nose of an unprotected person or an environmental surface. Droplets do not stay suspended in the air.
Wait, don't go in there. You need to put on your PPE first before you enter. This patient is an isolated room. So your stethoscope and the chart could be left outside the room. Next, we're going to use a mask. Now this patient, she has the flu, but she's getting better. And she took it to more than others. Why do we need the eye protection? Well, it would give us protection
just in case she coughs. So it will be a shield from material getting on us or in our eyes. You know, some people use goggles too. Okay. Right, you make sure the glove goes over your cough. Because of course in front of the shield could be potentially could be contaminated.
Droplet precaution guidelines. Wear a medical mask when within a 1 meter range of the patient. Put the patient in a single room or in a room that contains only other patients with the same diagnosis or with similar risk factors, and ensure that every patient is separated by at least 1 meter. Ensure that the transportation of a patient to areas outside of the designated room is kept to a minimum. Perform hand hygiene immediately after removing any item of PPE. Use clean, unsterilized gloves and a disposable or reusable gown whenever you have direct contact with a patient. Remove safely the gloves and gown immediately following any contact with a patient. Perform hand hygiene immediately after removing any item of PPE. Dedicate specific equipment for use with a single patient, and always clean and disinfect shared equipment between patient uses. Avoid touching your face, eyes, or mouth with either gloved or ungloved hands, as they may be contaminated. Place patients in a single occupancy room whenever possible, or alternatively with other patients with the same diagnosis. Personal protective equipment, droplet precautions, medical mask or surgical mask. Droplet precautions. Diseases which are spread via droplets can be transmitted by an infected person when talking, coughing, or sneezing. For example, adenovirus human influenza. Typically, droplets travel only a short distance through the air, but have the potential to land in the eyes, mouth, or nose of an unprotected person or an environmental surface. Droplets do not stay suspended in the air. Wear a medical mask when within a 1 meter range of the patient. Put the patient in a single room or in a room that contains only other patients with the same diagnosis or with similar risk factors, and ensure that every patient is separated by at least 1 meter. Ensure that the transportation of a patient to areas outside of the designated room is kept to a minimum. Perform hand hygiene immediately after removing any item of PPE. Pathogens transmitted through inhalation of droplet nuclei can remain infectious over a long distance, more than 1 meter. Diseases such as pulmonary tuberculosis, measles, and chickenpox are transmitted via this route. Airborne precautions should be applied until the mode of transmission is confirmed when dealing with a novel or unknown pathogen.
Right. So it goes like this. Right. And you have it hooked in the hand like this with the straps loose over the hand like that. Then you bring it up to the nose. Chin first, and then cover the nose. Upper band, and you put reaching on the top of the head. Then you use other band, reaching below the ears. Okay. Then you use both hands to get a seal. Exhale and see if you feel any air coming out from the respirator. Hi, Mrs. Rodriguez. We're here to pay your visit. This is my intern.
Hello, good afternoon, Mrs. Rodriguez. How are you feeling this afternoon?
Come out to the room. We need to do hand hygiene.
Use a particulate respirator whenever entering and providing care within the patient isolation facilities, ensuring that the seal of the respirator is checked before every use. Place the patient in an airborne precaution room, which has 12 air changes per hour, plus control of airflow direction. Limit the movement of the patient and ensure that the patient wears a medical mask if outside their room. Perform hand hygiene immediately after removing any item of PPE. Personal protective equipment. Never recap used needles. Never direct the point of the needle to any part of the body except prior to injection. Do not remove used needles from disposable syringes by hand, and do not bend, break, or otherwise manipulate. Dispose of syringes, needles, scalpel blades, and other sharp items in appropriate puncture-resistant containers, which should be located as close as practical to the area in which the items were used. Avoid the use of reusable syringes. Do not reuse needles. We would like to thank the volunteers who have offered their time and expertise to produce this video on occupational health and infection control in healthcare settings. Special thanks to the Ministry of Health from Trinidad and Tobago, Government of Canada, University of British Columbia, British Columbia Centre for Disease Control, and Vancouver Coastal Health for their support of this video.
As we go through our workday, we touch a lot of surfaces, some of which might be contaminated. Millions of workers every day are at risk from contaminations called blood-borne pathogens. Blood-borne pathogens are present in infected human blood and certain other bodily fluids, and some of them carry potentially fatal diseases. No matter what kind of work you do, you should always be aware of the risk of exposure to blood-borne pathogens, because when you know the risk, you can take precautions. You can be exposed to a blood-borne pathogen by touching an infected person or their secretions, or you can be exposed by touching something that has been contaminated by an infected person. So how do you protect yourself? You have to understand that something can be contaminated and the infected organism may not be visible. For example, linens, tabletops, washrooms, door handles, anything that may have been used or touched by someone else can spread a dangerous germ or virus. When you come into contact with an infected surface, the organism can transfer to you. Once it is on your body, any body opening can allow this pathogen to enter your system. This includes your nose, mouth, eyes, other body openings, any mucous membranes, and any cuts, abrasions, or any other breaks in the skin. For example, if an infected person coughs or sneezes on a table which is not cleaned after use, and then you touch the table with your hands, the infection may now be on your hands. If you rub your eyes or eat anything, the infection can pass into your system. This can be prevented by following simple guidelines that will protect you from exposure. You don't know if someone with a contagious disease has touched a surface, so good hand washing is the first and most effective method to prevent spreading infections. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected, and use proper gloves before cleaning anything that may have been exposed. Wash your hands before putting on gloves and immediately after removing them. If soap and water is not available, you can use a waterless hand sanitizer. Never touch clean objects with contaminated gloves, and avoid touching your face, eyes, nose, or mouth until after you have washed your hands. Protect yourself from blood-borne pathogens, use appropriate disinfecting agents, and use proper hand washing techniques. Thanks for watching, and have a safe day.
Blood-borne pathogens. OSHA 29 CFR 1910.1030. Freely available training for your staff. Please share and subscribe. Blood-borne pathogens. Course objective. Students shall understand and be able to describe what is a blood-borne pathogen, HIV, hepatitis B, hepatitis C, and how they are transmitted. Guidelines for handling blood-borne pathogens and other bodily fluids. Universal precaution. Personal protective equipment, PPE. What to do if an exposure occurs. Decontamination and sterilization procedures. Introduction. OSHA's blood-borne pathogens standard prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Implementation of this standard will not only prevent hepatitis B cases, but will also significantly reduce the risk of workers contracting AIDS, hepatitis C, or other blood-borne diseases. Blood-borne pathogens. As a universal precaution, treat all human blood and certain body fluids as if they are infectious. Definitions. What does blood-borne pathogens mean? Blood-borne pathogens means microorganisms that are present in human blood or other potentially infectious materials that can cause disease in humans. What types of diseases are there? Blood-borne pathogen diseases include, but are not limited to, hepatitis B virus, HBV, hepatitis C virus, HIV, which causes AIDS, malaria. Definitions. Occupational exposure means reasonably anticipated skin, eye, mucous membrane, or potential contact with blood that may result from the performance of an employee's duties. Reasonably anticipated exposure includes the potential for exposure as well as actual exposure to blood or other potentially infectious materials, APIM. It includes exposure to blood or APIM, including regulated waste, as well as incidents of needle sticks. This definition does not cover Good Samaritan acts, that is voluntarily aiding someone in one's place of employment, which results in exposure to blood or APIM. Definitions. Parenteral, such as an injury with needles and sharps. Prenatal, virus can be transmitted from a mother to her infant during pregnancy. PIM, potentially infectious materials. PPE, personal protective equipment. Transmission, how do you transfer pathogens? 4 ways to spread germs. Transmission of germs. 1. Airborne or respiratory route. 2. Direct contact route. 3. Fecal-oral route. 4. Blood contact route. Other potentially infectious materials, APIM. Bodily fluids including semen, vaginal secretions, synovial fluid, pericardial fluid, amniotic fluid, saliva and dental procedures, and any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between bodily fluids are to be assumed infectious. Any unfixed tissue or organ from a human being, such as torn skin, HIV-containing cell or tissue cultures, organ cultures, an HIV or HBV-containing culture medium or other solutions, and blood, organs, or other tissues from animals infected with HIV or HBV. At risk. You are always at risk for BBP. Why should you care? Approximately 5.6 million workers are at risk of exposure to blood-borne pathogens such as HIV, the hepatitis B virus, and the hepatitis C virus. OSHA's blood-borne pathogens standard prescribes safeguards to protect workers and reduce their risk against the hazards from exposure to blood and other potentially infectious materials. Every organization must have by law a specific written safety program regarding blood-borne pathogen safety and safeguards. Who is covered by the standard? All employees who could be reasonably anticipated as the result of performing their job duties to face contact with blood and other potentially infectious materials. Some workers are at risk. Some jobs within the city that are covered by the standard. Wastewater treatment workers. Medical waste treatment employees. Law enforcement personnel. Physicians, nurses and emergency room personnel. Orderlies, housekeeping personnel, and laundry workers. Dentists and other dental workers. Laboratory and blood bank technologists and technicians. Medical examiners. Morticians. Firefighters. Parks and recreation workers. Custodial services workers. Paramedics and emergency medical technicians. Anyone providing first response medical care. Home healthcare workers. Employees assigned to first aid response duties by their employer. Other workers assigned duties putting them at risk of occupational exposure. How does contamination occur? What risks do you have on your job that pose a hazard or expose you to blood-borne pathogens? How does exposure occur? Cuts from contaminated sharp items, knives, broken glass, sharp metal, sharp wires, etc. A contaminated sharp item is any contaminated object that can penetrate the skin. Contact of mucous membranes, eye, nose, mouth, or broken, cut or scraped skin with contaminated blood. Most common exposure is caused by needle sticks. 600,000 to 800,000 needle stick injuries occur each year in the United States. Keep in mind that all employees could come in contact with one or more of these exposure, not just medical personnel. Preventative measures. How do we prevent BBP contamination? Universal precautions. A universal precaution is the prevention strategy by which all blood and potentially infectious materials are treated as if they were in fact infectious. Treat all human blood and bodily fluids as if they are infectious. Must be observed in all situations where there is a potential for contact with blood or other potentially infectious materials. Engineering & work practice controls. These are the primary methods used to control the transmission of HBV and HIV. Engineering and work practice controls should be the first line of defense in keeping workers safe. When occupational exposure remains after engineering and work practice controls are put in place, personal protective equipment (PPE) must be used. Employers must obtain input from non-managerial employees who are potentially exposed to injuries from contaminated sharps and the identification, evaluation, and selection of engineering and work practice controls. Controls. These controls reduce employee exposure by either removing the hazard or isolating the worker. Controls reduce the likelihood of exposure by altering how a task is performed. All procedures involving blood or other potentially infectious materials shall be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of these substances. Mouth pipetting/suctioning of blood or other potentially infectious materials is prohibited. Preventative measures. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses are prohibited in work areas where there is a reasonable likelihood of occupational exposure. Food and drink shall not be kept in refrigerators, freezers, shelves, cabinets or on countertops or benchtops where blood or epidermis are present. Preventative measures. Contaminated broken glassware shall not be picked up directly with hands. Shall be cleaned up using mechanical means, such as a brush and dustpan, tongs, or forceps. Tools must be decontaminated after use. Shall be placed into a sharps container for proper disposal. Contaminated reusable sharps shall not be stored or processed in a manner that requires employees to reach by hand into the containers where these sharps have been placed. For example, do not dump contaminated reusable sharps in a sink of soapy water and then retrieve the devices from the sink by hand. Use a strainer basket to hold the immersed instruments, and forceps for their retrieval from the basket. Do not bend or break sharp objects. Personal protective equipment. Considerations. Personal protective equipment. Remember, engineering and work practice controls should be the first line of defense in keeping workers safe. When occupational exposure remains after engineering and work practice controls are put into place, personal protective equipment (PPE) must be used. Be sure to go over all of the personal protective equipment, including how to use it, when to use it, and how to access it. Personal protective equipment (PPE). The employer shall ensure that the employee uses appropriate personal protective equipment. All personal protective equipment shall be removed prior to leaving the work area. When personal protective equipment is removed, it shall be placed in an appropriately designated area or container for storage, washing, decontamination, or disposal. Specialized clothing or equipment worn by an employee for protection against infectious materials. Gloves, gowns/safety garments, boots, face shields, eye protection/goggles, mouthpieces and resuscitation devices. Mouthpieces and resuscitation devices must be supplied where employees are expected to perform CPR as an assigned duty. Gowns, aprons, hampers and other protective body clothing. The requirements for the use of personal protective body clothing and the degree to which it must resist penetration are performance-based. The employer must evaluate the task and type of exposure expected and, based on the determination, select the appropriate PPE. Masks in combination with eye protection devices, such as goggles or glasses with solid side shields, or chin-length face shields, shall be worn whenever splashes, spray, spatter, or droplets of blood or epidermis may be generated. Personal protective equipment. Gowns, aprons, hampers and other protective body clothing. Small splashes, spatters, and sprays of blood or a pin will usually be stopped by a cotton garment. Larger occurrences creating a potential for soak-through would require a garment of impervious construction. The street clothes must be protected from contamination. Long-sleeve garments shall be used for procedures in which blood or PIM exposure to the forearms is reasonably anticipated. Gloving. Put glove on clean hand. Remove by grasping outside at wrist, pull inside out. With ungloved hand, grasp on inside at the wrist and pull inside out over hand. Gloves shall be worn when it can be reasonably anticipated that the employee may have hand contact with blood, hand contact with a PIM, hand contact with mucous membranes, hand contact with non-intact skin. Perform vascular access procedures. Handle or touch contaminated items or surfaces. PPE maintenance. Utility gloves may be decontaminated for reuse if the integrity of the glove is not compromised. However, they must be discarded if they are cracked, peeling, torn, punctured, or exhibit other signs of deterioration or when their ability to function as a barrier is compromised. All personal protective equipment must be carefully checked before use to ensure that it is in good condition. PPE may not be used if damaged beyond repair. PPE must be properly cleaned, laundered, repaired, and disposed of at no cost to the employee. PPE must be removed when leaving the area or upon contamination. Housekeeping. Proper cleanup is the best way to prevent contamination. Housekeeping procedures. The employer must determine and implement an appropriate written schedule for cleaning and method of decontamination based upon location within the facility, type of surface to be cleaned, type of soil present, task or procedure being performed. The term worksite refers not only to permanent fixed facilities, such as hospitals, offices, etc., but also include temporary non-fixed workspaces such as mobile offices, ambulances, etc. Housekeeping. Effective use of disinfectants is an important factor in preventing healthcare-associated infections. Justification for using a disinfectant. Needed for surfaces contaminated by blood or PIM. Disinfectants are more effective in reducing microbial load. Detergents become contaminated and result in seeding the patient's environment with bacteria. Surfaces may contribute to transmission of epidemiological microbes, for example, VIR, MRSA, C. difficile. Housekeeping disinfection. Meticulous disinfection and hand washing will prevent transmission. Work surfaces must be decontaminated with an appropriate disinfectant. After completion of a task or procedure. When surfaces are contaminated. At the end of the work shift. Who washes hands more? After using toilet. Women 74%. Men 61%. New York City 60%. Chicago 78%. New Orleans 69%. Atlanta Braves game. Women 89%. Men 46%. Housekeeping disinfection. In the U.S., to comply with OSHA's rule on blood-borne pathogens, a blood spill must be cleaned using a disinfectant. Blood should be disinfected using an EPA-registered disinfectant, a disinfectant with a HBV/HIV claim, or a solution of bleach between 110 and 100 with water. The list of EPA-registered products are available from the National Antimicrobial Information Network. Housekeeping. Protective coverings used to cover equipment and environmental surfaces shall be removed and replaced as soon as feasible when they become contaminated or at the end of the work shift. Bins, pails, cans, and similar receptacles intended for reuse which have a reasonable likelihood for becoming contaminated with blood or a PIM shall be inspected and decontaminated on a regularly scheduled basis, and as soon as feasible upon visible contamination. Standard microbiological practices or regulated waste shall either be incinerated or decontaminated by a method such as autoclaving known to effectively destroy blood-borne pathogens. Warning signs and labels. Warnings. Containers of regulated waste. Refrigerators and freezers containing blood or IPM. Other containers used to store, transport, or ship blood or IPM. Contaminated equipment prior to shipping. These labels shall be fluorescent orange or orange red or predominantly so, with lettering and symbols in a contrasting color. Red bags or containers may be substituted for labels. Labels shall be affixed as close as feasible to the container by string, wire, adhesive, or other method that prevents their loss or unintentional removal. The standard requires that warning labels be attached to signs. When other potentially infectious materials or infected animals are present in the work area, a hazard warning sign incorporating the universal biohazard symbol shall be posted on all access doors. The employer shall post signs at the entrance to work areas, which shall bear the following legend. Name of the infectious agent. Special requirements for entering the area. Name, telephone number of the laboratory director or other responsible person. These signs shall be fluorescent orange red or predominantly so, with lettering and symbols in a contrasting color. Laundry procedures. When a facility uses universal precautions in the handling of all soiled laundry, alternative labeling or color coding is sufficient if it permits all employees to recognize that the containers require handling in compliance with universal precautions. Handle contaminated laundry as little as possible, and use PPE. Laundry must be bagged or containerized at the location where it is used. Laundry must be placed and transported in labeled or color-coded containers. Exposure procedure. Exposure procedure. Blood-borne pathogen exposure control training log. Exposure incident report form. Post-exposure evaluation by health provider form. Post-exposure referral to health provider form. Hepatitis B vaccine declination mandatory. Sharps injury log. Exposure procedure. At a minimum, the log must contain, for each incident, type and brand of device involved, department or area of incident, description of incident, Sharps injury log. Disease prevention. Medical record keeping requirements. Employee's name and social security number. Employee's hepatitis B vaccination status. Results of examinations, medical testing, and post-exposure evaluation and follow-up procedures. Healthcare professional's written opinion. Information provided to the healthcare professional. Employee medical records must be kept confidential and not disclosed or reported without the employee's written consent, unless required by law. Medical records must be maintained for duration of employment, plus 30 years according to OSHA's rule governing access to employee exposure and medical records. Hepatitis B vaccination requirements. The city must make available, free of charge at a reasonable time and place, to all employees at risk of exposure within 10 working days of initial assignment unless employee has had the vaccination. Antibody testing reveals immunity. The vaccination must be performed by a licensed healthcare professional. Vaccine must be provided even if the employee initially declines, but later decides to accept the vaccination. Hepatitis B vaccination requirements. Employees who decline the vaccination must sign a declination form. Employees are not required to participate in an antibody PRESCRENING program to receive vaccination series. Vaccination booster doses must be provided if recommended by the U.S. Public Health Service. Contact your supervisor if you need to. Schedule the hepatitis B vaccine. Hepatitis B vaccination. The Center for Disease Control states that employees who have ongoing contact with patients' blood or other IPM, and are at ongoing risk for injuries taking place through the skin via sharp instruments, I.E. needle sticks, be tested for antibodies to hepatitis B surface antigens. This testing needs to be done within 1 to 2 months after completion of the 3-dose vaccination series. Employees who do not respond to the primary vaccination series must be revaccinated with a second 3-dose vaccine series, and retested. Non-responders must be medically evaluated. Hepatitis B. The employer's exposure control plan specifically addresses the provision of the hepatitis B vaccine to all unvaccinated first aid providers who assisted in any situation involving the presence of blood or IPIM. This provision is regardless of whether an actual exposure incident has occurred. The post-exposure evaluation and the follow-up for those employees who experience an exposure incident include Hepatitis B, a provision for a reporting procedure that ensures all first aid incidents involving blood or IPIM are reported to the employer. The report must include the names of first aid providers and a description of the incident, including time and place. B. Provision for the blood-borne pathogens training program for designated first aid providers to include the specifics of the reporting procedure. C. Provision for the full hepatitis B vaccination series to be made available as soon as possible, but in no event later than 24 hours, to all unvaccinated first aid providers who have rendered assistance in any situation involving blood or IPIM. Hepatitis B, HBV, occurs when the HBV virus enters the body, multiplies in the blood and infects the liver. Can result in mild illness or permanent liver damage. Most individuals recover. Death does occur in rare cases due to liver failure. Hepatitis B is the cause of up to 80% of liver cancer. How hepatitis is spread. Infected person to uninfected person through sexual intercourse. IV drug users that share needles. Tattooing with unspecialized equipment. HBV/HCV infected mothers passing virus to their unborn child. HBV/HCV infected mothers passing the virus in breast milk. Blood-to-blood transmission through blood transfusion, breaks in skin or through mucous membranes. Hepatitis B can survive on surfaces dried and at room temperature for at least a week. Vaccination is available. Symptoms: yellow eyes and skin, jaundice, abdominal pain and swelling, fever and vomiting, skin rash. Hepatitis C. Serious, sometimes fatal disease that affects the liver. Not as infectious as hepatitis B, but more common. Vaccination is not available. Symptoms: yellow eyes and skin, jaundice, sore muscles, headache, abdominal pain, nausea, dark urine, weight loss, fatigue. How HIV infection is spread. Infected person to uninfected person during unprotected sexual intercourse. Infected intravenous drug users when they share needles and syringes contaminated with blood. Women infected with HIV can pass the virus to their unborn child. As the virus can be transmitted through breastfeeding, breastfeeding is not recommended to infants of infected mothers. Blood-to-blood transmission when the infected blood enters the bloodstream by blood transfusion, breaks in the skin, mucus, or needle sticks. AIDS reduces the body's ability to fight off normal diseases. Transmitted mainly through sexual contact and contaminated needles. Can be spread by contact with infected blood and body fluids. It cannot be transmitted by touch. HIV, which causes AIDS, is very fragile and survives only a short time outside the human body. Symptoms include fever, swollen glands, diarrhea, abdominal cramps, extreme weight loss, skin rash or lesions. Post-exposure. What to do if an exposure occurs. Promptly wash or flush the affected area. Irrigate eyes with water or saline. Report the exposure to your supervisor. Get medical attention from a healthcare professional. Serious exposures will require the initiation of drug therapies that are believed to be most effective when given within a few hours of the exposure. Treatment should begin as soon as possible after exposure, within 24 hours. The Center for Disease Control currently recommends treatment within 2 hours of exposure. I've been stuck. What to do in case of a spill or accident that results in an exposure. Report event immediately to your supervisor, laboratory director, or other responsible person. All spills shall be immediately contained and cleaned up by an appropriate professional staff or others properly trained and equipped to work with potentially infectious materials. Proper PPE must be used. Equipment and tools must be cleaned and decontaminated before servicing or being put back in use. Use a solution of 1/4 cup of bleach per 1 gallon of water. Cover spill with paper towels or rags, then gently pour bleach solution over towels/rags. Avoid splashing and leave for at least 10 minutes. Wash exposed area with EPA-approved disinfectant. Post-exposure follow-up. Document routes of exposure and how exposure occurred. Record injuries from contaminated sharps and a sharps injury log. Obtain consent from the source individual and the exposed employee and test blood as soon as possible after the exposure incident. Post-exposure follow-up. Provide risk counseling and offer post-exposure protective treatment for disease when medically indicated in accordance with current U.S. Public Health Service guidelines. Provide written opinion of findings to employer and copy to employee within 15 days of the evaluation. Employer responsibilities. Employees are required to do the following under OSHA. Employer responsibilities. Each employer shall ensure that a copy of the exposure control plan is accessible to all employees. The exposure control plan shall be made available to the Assistant Secretary and the Director upon request for examination and copying. A key element of the exposure control plan is the exposure determination. In the exposure determination, the employer is required to identify and document job classifications where occupational exposure to blood in a PIM can occur. This determination shall be made without regard to using personal protective equipment. Employer responsibilities include training employees initially and through annual updates, implementing a written plan, enforcing good work practices, following universal precautions, proper disinfecting practices, and waste disposal, controlling exposures through the use of needle buckets, biosafety cabinets, needleless IV systems, and self-sheathing needles, providing personal protective equipment (PPE), identifying hazards by proper labeling, including incubators, freezers and centrifuges. Must employ and go over good housekeeping. Employers shall provide hand-washing facilities which are readily accessible to employees. Employers shall ensure that employees wash hands and any other skin with soap and water, or flush mucous membranes with water immediately or as soon as feasible following contact with blood or other potentially infectious materials. Employer responsibilities. Training requirements. Provide at no cost to employees during working hours. Provide a time of initial assignment to a job with occupational exposure, and at least annually thereafter. Annual training for all employees shall be provided within 1 year of their previous training. Additional training needed when existing tasks are modified or new tasks are required which affect the worker's occupational exposure. Maintain training records for 3 years. Training. Employers and employees have responsibilities. Training. Material appropriate in content and vocabulary to educational level, literacy, and language of employees shall be used. Training shall be provided as follows. The employer shall assure that employees demonstrate proficiency in standard microbiological practices and techniques, and in the practices and operations specific to the facility before being allowed to work with HIV or HBV. The employer shall assure that employees have prior experience in the handling of human pathogens or tissue cultures before working with HIV or HBV. Training program elements. A. An accessible copy of the standard and explanation of its contents. B. A general explanation of the epidemiology and symptoms of blood-borne diseases. C. An explanation of the modes of transmission of blood-borne pathogens. D. An explanation of the employer's written exposure control plan, and how employees can obtain a copy. E. An explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood or PIM. Training program elements. F. An explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and PPE. G. Information on the types, proper use, location, removal, handling, decontamination and disposal of PPE. H. An explanation of the basis for selection of PPE. I. Information on the hepatitis B vaccine, including information on its efficiency, safety, methods of administration, the benefits of being vaccinated, and that the vaccine and vaccination will be offered free of charge. Training program elements. J. Information on the appropriate actions to take and persons to contact in an emergency involving blood or IPIM. K. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available. L. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee experiencing an exposure incident. M. An explanation of the signs and labels and/or color coding required and used in the facility. N. An opportunity for interactive questions and answers with the person conducting the training session. Training. The person conducting the training shall be knowledgeable in the subject matter covered in the training program. Training solely by means of a film or video, without the opportunity for a discussion period, would not be acceptable. Generic films, videos, or computer programs, even an interactive one, is not considered appropriate unless the employer supplements such training with the site-specific information required. Trainees must have direct access to a qualified trainer during their training. Employee responsibilities. You are responsible for your training to avoid contaminating yourself and others. Employee responsibilities. Attend training. Comply with and enforce the exposure control plan. Be sure to know proper procedures and contacts in case of an exposure. Segregate medical waste properly. Be sure to know facilities labeling codes. Properly select, wear, remove, and dispose of personal protective equipment, PPE. Summary. Summary. OSHA's blood-borne pathogens standard prescribes safeguards to protect you against the health hazards from exposure to blood and other potentially infectious materials, and to reduce your risk from this exposure. Implementation of this standard not only will prevent hepatitis B cases, but also will significantly reduce the risk of workers contracting AIDS, hepatitis C, or other blood-borne diseases. The best precaution against contamination is to have safeguard work practices in place to eliminate the exposure to the hazard. When that is not possible, then the use of PPE is absolutely necessary. More information. The Safety Emergency Management Office, 623-773-7679. OSHA website at www.osha.gov.